Good morning. So really nice to see you again. Your Excellency, the First Lady of Republic of Ghana and Ambassador of Merck Foundation More Than a Mother, and my dear friend and sister, Her Excellency Mrs. Rebecca AKUFO ADDO. Thank you very much for your generosity and being with us and always make us feel at home. And of course, Professor Frank Stangenberg Haverkamp, the chairman of Merck Foundation Board of Trustees and Merck family member, and president of Fertility Society of Ghana, president of Ghana Medical Society Association, and also the rector, Ghana College of Physicians and Surgeons, president of National Diabetes Association, future healthcare providers, and future expert Merck Foundation alumni of Ghana, and also the distinguished media partners and winners of Merck Foundation Awards. Thank you very much. Welcome to our Merck Foundation Ghana Alumni Summit 2024. I would like to extremely thank Her Excellency, the First Lady of Ghana, for make this success happen. It's a huge milestone that we started together in 2018, as you've seen in the journey, and we never stop communicating or following up on our program even during Corona pandemic. I'd like to thank Her Excellency and her very active team because without them, this will never happen. As you've seen in the journey, you've seen that we met 3 times online while Corona was there. We never stopped. We never say, okay, we will continue, we will resume after Corona finish. No, she was very keen to continue with all the programs and with all the scholarships because she believes, and we believe, that the healthcare capacity building and the education, especially educating girls, are very important for the social and economic development of the country and for all Africa. Therefore, with our working together closely and the ambassadorship that Her Excellency have, we worked to provide until today. You can see in the journey partnership is 142, but today is updated to 146 scholarships provided to Ghanaian doctors in 42 critical and underserved specialties. The number will still grow, will continue grow, and the sky is the limit. Of course, it's very important, as you know, because as a specialties, it's very important. For example, oncology, diabetes, hypertension, cardiovascular preventive, sexual and reproductive care, fertility and embryology, acute medicine, respiratory care medicine, endocrinology, the pediatric emergency, psychiatry, many specialties that's very important for the Ghanaian population and for all Africa. And many of them was among the first in their provinces or in the whole country, because our scholarships, as we agreed, that we are going to provide it to nationwide in Ghana, and not only in Accra, but all the provinces and districts. And we succeeded with Her Excellency to achieve that. Therefore, we have a nationwide scholarship program, and we are waiting and looking forward to receive more applicants to increase the number of these scholarships. Of course, if I tell you that in total in Africa and in Asia and developing countries, Merck Foundation provided more than 1,010 scholarships for doctors from 52 countries in 42 critical and underserved specialties, which I mentioned. It's a huge number. It is actually a huge milestone. I don't see that any foundation before us or even currently have provided such opportunity to improve access to equitable and quality healthcare solutions and to transform the patient care landscape in Africa, in many countries in the continent. So as you know, there were many countries like Burundi, Gambia, Sierra Leone, Liberia, Guinea, Chad, Niger, Central African Republic. They didn't have even single specialist in these specialties. We trained the first. We trained the first in many, many countries. And this is achievement and impact. It's deniable. And you don't even need to measure it because it's obvious from 0 to 1, from 0 to 2, 3, 4. So its impact is actually there, and you don't need to measure it, as we said. Of course, Educating Linda program as well. It's part of our scope, and we are working with Her Excellency. You will see today that we are going to sign storybooks, especially for children, about diabetes, for example, awareness, about hypertension awareness, about educating girls, ending child marriage, stigma of infertility. This is very important for children, for youth, for everyone, even us. And these storybooks has been converted to animation films that I'm going to share with you today when we have time by the end of the speeches, so you understand and you can see how to use it in your clinics, in the waiting rooms of the hospitals, in the website of your work, and media can also share it in their outlets. Especially all of us now have social media, and we have also online outlet. It can be used and everyone can benefit from it. So I really urge you to do that because it will be great. But of course we have Koezi with us today. Hi. Our musician partner, which we've done a lot of beautiful music about different topics and our awareness. Either he created the music and we found the musicians from across Africa, or he sang it himself. So we've done a great job in No More Diabetes, Girls Can, and Superwoman. So many things. Treat Her Like a Lady to prevent gender-based violence. Too many songs. I wish that I can share it all with you now, but there is no time. So we will also share it with you after that on your WhatsApp groups and all this, to also listen to it and enjoy, but also benefit. Of course, More Than a Mother. More Than a Mother campaign, which Her Excellency is ambassador for. It's a movement. It's actually very important for us, and as African women, and as also me as a CEO of Merck Foundation, because through that we empower women through access to health, information, education, and change of mindset, and sometimes economic empowerment. So she can be a woman, more than a mother, even if she had children. Women are more than mothers because they have their careers, they have their education, they have their lives, they are contributing to society. So it's not stop here. So, especially when we know that not only women should be blamed for infertility. It's a shared responsibility. It's 50-50 between men and women. Therefore, this campaign is very important. Also, the prevention, knowing that 1 every 4 couples are infertile in Africa, which is a huge number, but 85% of this percentage can be prevented, and is actually due to untreated infectious diseases that are caused by FGM, child marriage, unsafe abortion, unsafe delivery. So it's caused by everything we are advocating against every day. So this is very, very important, and we also have the awards, the media awards, and the songs and the film and fashion awards that also to address this topic. So finished now. I will not take too much time from you because I will leave other things to our chief guests and our speakers to talk about. But I wanted to share that with you because, as you know, I'm very passionate about all of them, and I really feel that it's part of not my work only, but also part of my life, which I'm sharing with you. So thank you very, very much, and hope to see you again soon.
Thank you very much. Your Excellency, Mrs. Rebecca AKUFO ADDO, the First Lady of the Republic of Ghana and Ambassador of Merck Foundation More Than a Mother, distinguished partners, the Presidents of the Fertility Society of Ghana, President of the Ghana Medical Association, Director of the Ghana College of Physicians and Surgeons, President of National Diabetes Association of Ghana, future healthcare experts, Merck Foundation Alumni of Ghana, distinguished media partners and winners of Merck Foundation Awards, dear guests. Thank you very much to each of you for being with us today. So I'm extremely pleased to welcome our long-term partner, Her Excellency Mrs. Rebecca AKUFO-Addo, the First Lady of the Republic of Ghana and Ambassador of Merck More Than a Mother. Your attendance really underscores our commitment towards building healthcare and media capacity, patient care landscape transformation, supporting girl education, and breaking the infertility stigma in Ghana. All very important causes. We also met Her Excellency during our annual conference, Merck Foundation Africa Asia Alumni 2023. You saw some of the snippets already in the little film which was shown at the beginning. And this meeting was held in October 2023 in Mumbai. Her valuable participation was indeed very important for our annual conference. During our meetings, we discussed the impact of our ongoing programs and our future plans to scale up our partnership. And of course, with these meetings, we all learn how to improve our work further. As you all know, our long-term partnership with the First Lady of Ghana began in 2018, and we have achieved a lot since then. I'm proud to share with you all that Merck Foundation has provided 143 scholarships of 1-year online PG diploma and 2-year master degree for local doctors in 40 underserved critical medical specifications in Ghana, such as fertility, cancer, diabetes, cardiology, endocrinology, respiratory, acute medicine, sexual and reproductive care, embryology, respiratory, critical care, psychiatry, general surgery, dermatology, emergency and restitution medicine, gastroenterology, neuroimaging for research, pain management, rheumatology, and neonatal medicines. I mentioned them all that you can see what sort of broad program we are working on. The objective of this program is to contribute to building healthcare capacity in the public sector with the aim to establish a strong platform of skilled and specialized healthcare providers across Ghana's public healthcare sector. We are aiming to improve the overall health and well-being of people by building healthcare capacity across Africa and also in some Asian countries and other developing countries in the world. We are strongly committed to transforming the patient care landscape through our scholarship programs. We strongly believe that empowering people will lead to a better future. We also believe good healthcare can transform the lives of individuals and families across developing countries, and very important, it can significantly contribute to economic and social development in those countries, because healthcare is a major driver of economic growth and consequently of social progress. We all know that the lack of financial means is not the only challenge in Africa or the rest of the world, but a scarcity of trained healthcare personnel capable to tackle disease prevention, diagnosis, and management at all levels in the healthcare system is the biggest challenge. The sweeping shortage of medical and healthcare manpower has been a crucial limiting factor. As per WHO 2017 report, Africa had just 168 medical schools in the entire continent, just 1 medical school in 24 countries, and no medical school in 11 countries. Sub-Saharan Africa, with 24% of the world's disease burden, has only 2.8 healthcare workers per 10,000 capita. This is compounded by the maldistribution of workforce among urban and rural areas and the public and the private sector. For example, before the start of the Merck Foundation programs in 2012, there was not a single oncologist, fertility specialist, reproductive care specialist or diabetologist in many countries. Countries such as the Gambia, Liberia, Sierra Leone, Central African Republic, Guinea, Burundi, Niger, Chad, Ethiopia, or even Namibia. Moreover, infectious diseases and undernutrition have been two of the most popular agendas that have dominated the global healthcare discourse in the developing world ever since the advent of global health cooperation. With the transition in developing countries in recent decades and the emergence of chronic non-communicable diseases such as cardiovascular, hypertension, and diabetes, or cancer as significant public health problems, increasing attention has been accorded to combating the double burden of communicable and non-communicable diseases, sometimes called the triple burden, after adding injuries and degenerative conditions to it. The relative share vary considerably across the developing world. For instance, non-communicable diseases are now the overall leading causes of mortality and morbidity in many of the developing countries, superseding infectious diseases. As per WHO organization, around 45 million adults in the African region have high risk of developing type 2 diabetes, and that is increasing. Whereas WHO estimated that the prevalence of hypertension is highest in the African region and will keep increasing if not controlled. As for cancer, Africa records around 1.1 million new cases of cancer every year, resulting in up to 700,000 deaths. Again, all as per WHO data from 2017, so probably the actual figure is much higher. The mortality rate of cancer patients is very high in Africa as compared to the rest of the world. One of the key reasons is also the late diagnosis of the disease. Moreover, Africa has only 3% of the world's cancer treatment facilities by such a big continent. Therefore, together with local partners, Merck Foundation continues their efforts in transforming patient care landscape through our Merck Foundation scholarship programs. Till today, more than 1,760 scholarships have been provided for young doctors from 52 countries in 42 critical and underserved medical specialties. Many of them are becoming the first specialists in their country, such as in Namibia, Liberia, or the Gambia, Ethiopia, or the Democratic Republic Congo. Dear partners and alumni, last but not least, I'm glad to meet you today here from all of you. Your feedback, success stories, and experience gained from these training and educational programs, which will you present us later. I congratulate you all. I know many of you have already graduated and the rest are undergoing the scholarship successful. We very much appreciate you are taking your study seriously, as it will significantly contribute towards your future career and towards the quality of your practice, hence will further contribute to the improving patient access to equitable and quality healthcare in your country. Today, we are also meeting and recognizing the winners of Merck Foundation Media, Fashion and Song Awards in 2022 and 2023. Well done. Happy to meet you all. I'm very proud of all of you that you achieved this. We at Merck Foundation strongly believe in the critical role that media and art plays in creating a cultural shift and to address all social and health issues in your communities. I'm sure that all of you know, as our social and health care champions, you can and will make a change. Be the voice of the voiceless and educate the communities about various social and health issues. I would also like to acknowledge your role as health champions in your community and to acknowledge your collaboration with our media recognition winners, who are also Merck Foundation alumni like yourself, to help them to sensitize community members and separate myths from fact, hence raise awareness about different critical and sensitive social and health issues in a science and ethical way. So let's all work together to transform the patient care landscape and raise community awareness about sensitive and critical health and social issues in Ghana and also, of course, across the African continent. So I'm looking forward to meeting you all again after the rest of you graduated to celebrate your success then next year or the year after. Thank you very much.
Good morning, everyone. Professor Dr. Frank Stangenberg Haverkamp, Senator Dr. Rasha Khaled, CEO, distinguished partners, Merck Foundation Alumni of Ghana, distinguished media partners, and winners of Merck Foundation Awards, distinguished ladies and gentlemen. It is wonderful to welcome our esteemed Professor Dr. Frank Stangenberg Haverkamp and Dr. Rasha Khaled, and the entire Merck Foundation team once again to Ghana. I am indeed excited to host the Merck Foundation Ghana Alumni Summit and Award Ceremony. Today, we celebrate an important milestone, a culmination of a great partnership between my office and the Merck Foundation since 2018. This partnership has enabled Ghana to build healthcare capacity, transform patient care, break infertility stigma, and support girl education. Today, Ghana can boast of more specialists in very critical areas of medicine because of Merck Foundation. This valuable program has made a substantial contribution to enhancing access to equitable and quality healthcare solutions in many deserved specialties. For me, this is simply revolutionary. I truly thank Merck Foundation for this significant intervention in our health services delivery. I'm also proud of all of you, Merck Foundation alumni. You are the future healthcare experts of our country. Infertility has always been a taboo topic in our African context. With the Merck Foundation More Than a Mother Ambassador program, Ghanaians are being more open with infertility, seeking help and reducing stigma. Education for girls is the singular drive for empowering our girls. It is my passion to see girls stay in school or acquire skills for life. I acknowledge and thank Merck Foundation on our partnership for girls' education, Educating Linda, and Because I Want to Be television mentoring program. Together, we are ensuring girls are heard, seen, and empowered for a great future. Under our partnership with Merck, we have had several trainings for the media to help break the silence and be the voice of the voiceless on issues such as infertility and other sensitive social and health issues. This media collaboration has expanded awareness of key social issues in Ghana. As a lover of the arts, I'm encouraged by Merck Foundation's More Than a Mother and promoting healthy lifestyle awards for musicians, fashion designers, filmmakers, students, and potential talents in these fields. These awards have promoted the discussion of critical social issues and given young people the opportunity to showcase their talents. I am therefore excited today to meet and recognize our media, fashion, film, and song awards winners. I'm also happy that we have previous winners with us. I congratulate you all. Please continue to be the voice of the voiceless through your work. It is important that I also acknowledge that together with Merck Foundation, we have produced children's books, namely More Than a Mother, Jacqueline's Rescue, Not Who You Are, Ride into the Future, Sugar-Free Jude, and Mark's Pressure, and Educating Aku. These storybooks address very important issues for our young children. We have received thousands of copies of these storybooks for distribution to our children. We will also give out some signed copies at the end of today's program. Permit me to take a moment to congratulate Merck Foundation for winning the Best Health Sector Philanthropy of the Year 2023 award at the Ghana Philanthropy Awards. There is no doubt about the amazing achievements of Merck Foundation under the leadership of Frank and Russia. Your efforts to improve the lives of people in Ghana and all over Africa and Asia are truly remarkable. Once again, I welcome you to our beautiful country, Ghana, and I thank you.
Thank you very much. Good morning. Professor Stangenberg, Haverkamp, Her Excellency, Mrs. Rebecca AKUFO, First Lady of Ghana, and the indefatigable Rasha Kelev, Senator and CEO of Merck Foundation. Fellow doctors, embryologists, cardiologists, I could name any branch of medicine, and all alumni, old and new, and those in training. It is my pleasure to stand before you this morning to share a little bit about the influence of Merck Foundation on healthcare professional capacity in Ghana. My first encounter with Merck Foundation was in 2015 at the second luminary of the organization in Nairobi, Kenya. I almost didn't go because I had a very tight schedule, but took one day off to go. And I was amazed at the enthusiasm of this organization. As I said, the CEO, her enthusiasm with her mission, and the large philanthropic heart of the Board of Trustees made things move very quickly. And the way they carved this was building inroads into various countries, that's developing countries, that had this need, but they knew where to hit best. And that was the first ladies, because if you get the first lady to agree, the first man would definitely agree. So I saw Merck Foundation growing and developing, and then they started with a few opportunities of scholarships, but they didn't stop it there. They keep on opening more avenues so they can get more and more people in. If you look at the awards, scholarship awards for training, which they bring out, it's growing by the year. Each time they are opening more doors for us. And I would say this didn't just bring those of us or the alumni who have trained in here, but it's had a lot of collateral effects. It was at the Merck Foundation meeting, the first one, that I met Prof. Shiru and Lalubu, and we started talking about the African Fertility Society. But we hadn't even a National Fertility Society yet. That pushed me to quickly get my people around, and that was done. And through that, we developed curricula, and we're training specialists in Ghana now. And that is also to the laurels of Merck Foundation. Thank you very much. We didn't stop there. We went on to develop nurses' curriculum, which was also presented last month at the African Federation of Fertility Societies in Tunisia, and even won an award, and is also going to be rolled out in September at the Nursing and Midwife, at the Ghana Nurses and Midwife Council, sorry. Yeah, so the effect of Merck Foundation on building capacity in Ghana is immense. It's immense because it addresses not only fertility, cardiology, cancer, diabetes, etc., and other colleagues of mine will come and highlight on those areas. I think we can only do well by letting the alumni do effective reimbursement of this investment in them. They should not just be trained and come back and then leave the country in a year or two to go somewhere else. Merck Foundation saw the need for you in this country, and that is why they have invested in this. We shall continue to give them all the support they need, because if we can get a few foundations like this around the continent, we will go far. Thank you very much, Merck Foundation.
Her Excellency, Mrs. Rebecca AKUFO ADDO, First Lady of the Republic of Ghana, and Ambassador of Merck Foundation More Than a Mother. Professor Dr. Frank Stangenberg Haverkamp, Chairman, Merck Foundation Board of Trustees, and former Chairman of Executive Board, EMAC KG. Senator Dr. Rasha Kalev, CEO of Merck Foundation and President of More Than a Mother campaign, distinguished partners of Merck, senior colleagues of the noble profession here, and all healthcare professionals here present, invited guests, ladies and gentlemen. I bring you greetings from the Ghana Medical Association. Unfortunately, my president is not able to make it today because there is a pressing assignment that has taken him out of the jurisdiction. We recount over half a decade partnership with Merck, and this has seen a good number of physicians in particular, and healthcare professionals in general, getting much needed training in essential fields of practice. And as an association that is not only interested in the welfare of its members, but in the holistic development of physicians, partnership with Merck has been a great welcoming and a timely news. A lot has been said already. I don't need to belabor the point that have already been made. The sponsorship for training, be it online, part-time or in full-time, has had significant impact on physician practice in this country. And not only has it enhanced the individual knowledge base of the awardees, but it has also benefited healthcare delivery in general in Ghana. It has also contributed to sharing knowledge of acquired by awardees through programs that have been organized by the association over the years. And when I look at the people sitting here, I can see a number of people who have been facilitators of programs that we've organized over the years. I see Dr. Sefoga here, and quite a number of people who have shared their knowledge with us. And what that does is that it does not only limit it to those who acquired it, but it extends that knowledge to other physicians as well. Going forward, we look to not only maintain the existing partnership with Merck Foundation, but also hope that this will be strengthened in the years ahead. We say AKUFO to all the awardees and alumni here present, and AKUFO to Merck. Thank you very much.
Your Excellency, the First Lady, Mrs. Rebecca AKUFO, the Merck Foundation CEO, and the Trustee Board Chair. Distinguished ladies and gentlemen, I stand on all existing protocol. And the Society of Obstetricians and Gynecologists is greatly pleased to be a part of this monumental Merck Foundation Ghana Alumni Summit today. Undeniably, the Merck Foundation has made remarkable impact, both directly and indirectly, on obstetrics and gynecology patient care in Ghana. And this has been achieved through various initiatives that the foundation has rolled out over the past 5-6 years. Importantly, the foundation has been a critical player in enhancing advanced medical education and training of healthcare professionals, as has been alluded to earlier, and in contributing to improve the age-old challenge of inadequate specialized medical personnel, specialists and subspecialists across the various aspects of healthcare, particularly women's health, and even especially in the area of non-communicable diseases and cancers. The foundation continues to provide scholarships and training programs for our doctors in obstetrics and gynecology. These have largely been in the area of gynecological oncology, cancers, reproductive endocrinology and infertility, and some vaccine-related problems. These programs have enabled many Ghanaian doctors to pursue advanced degrees and specialized training, equipping them with the skills, knowledge, and abilities that have been needed to provide high-quality care to women and their newborns in Ghana. Your Excellency, ladies and gentlemen, these investments continue to make a significant contribution towards reduction in maternal morbidity, mortality, infant mortality, and morbidity, which are all critical areas and a national priority to the people and the government of Ghana. Furthermore, the Merck Foundation has launched various public health campaigns aimed at raising awareness about maternal health issues and promoting best practices in obstetrics and gynecology. These campaigns have been pivotal in educating communities about the importance of prenatal care, safe delivery practices, and prevention and treatment of some common reproductive health issues, including cervical cancer. By empowering women with knowledge, the Merck Foundation has further helped to foster a culture of proactive health seeking, which leads to healthier pregnancies and their outcomes. One of the Foundation's notable initiatives has been the Merck More Than a Mother campaign that Our Excellency, the First Lady, is an ambassador for. And this campaign has addressed the unfortunate social stigma associated with infertility and childlessness. In Ghana, and just as it is in many parts of Africa, women who are unable to conceive often face discrimination, social isolation, stigma, physical and emotional abuse. And these contribute to remarkable psycho-emotional distress, which have sometimes led to severe depression and suicide. The Merck Foundation's campaign has been successful in challenging some of these negative perceptions and providing support to women experiencing infertility. Through this initiative, the Foundation has facilitated access to fertility care and treatment, and thereby giving hope to otherwise childless women, couples, and families. These efforts have not only saved lives, but also empowered women and, by extension, families in Ghana and across Africa. The positive impact of the Merck Foundation on Ghana's healthcare landscape serves as a powerful testament to the transformative potential of what has become known as a strategic philanthropic investment in global health, particularly in women's sexual reproductive health and rights. Your Excellency, ladies and gentlemen, as the lead professional society for women's health in Ghana, we congratulate the Merck Foundation on yet another summit here in Ghana, and we pledge our professional support to continue to advance the health care of the people of Ghana by partnering with Merck through the dissemination of the knowledge that our people acquire through the scholarships rendered to young healthcare professionals in Ghana. We wish you a very successful Alumni Summit, and thank you for your attention.
Excellency, Mrs. Rebecca AKUFO, the First Lady of the Republic of Ghana, the Chairman of Merck Foundation, the CEO of Merck Foundation, colleague doctors, and all professionals present. Good afternoon to you all. My name is Dr. Eku Anyama, and I am a family physician at the Achimota Hospital, Accra, Ghana. I stand before you today to share my heartfelt gratitude and positive experience with the Merck Foundation, which generously offered me a scholarship for postgraduate diploma in diabetes, a program I successfully completed in the year 2022. This scholarship program was a transformative journey, I must say. The curriculum was comprehensive, covering the latest advancements in diabetes management. The mode of study was flexible, allowing me to balance my professional duties while enhancing my knowledge. The faculty were exceptional, providing valuable insights and support throughout the course. Their expertise and dedication played a significant role in enriching my learning experience. This scholarship has profoundly impacted my professional practice. With enhanced knowledge of diabetes and its management, I can now offer specialized care to my patients. This has reduced the need for referral to other facilities. As I, together with my team, can manage complex cases within our facility, my patients have expressed greater satisfaction with the care they receive, appreciating the personalized and informed approach I bring to their treatment plan. One case that stands out involves a middle-aged man, Mr. SK, with uncontrolled diabetes as well as multiple complications. Thanks to the advanced knowledge and skills I acquired from Merck Foundation program, my team and I successfully managed his condition, stabilizing his blood sugar levels and significantly improving his overall health. This case, among many others, underscores the real-world benefits of the training we received. Since completing the course, I have achieved several milestones. At Achimota Hospital, I play a significant role in the diabetic clinic which runs on Thursdays. I have trained other doctors and nurses on diabetes management, prevention, and management of its complications. Additionally, I have organized awareness programs for patients and their families, educating them about diabetes management and prevention, thus empowering them to lead healthier lives. In conclusion, the Merck Foundation Scholarship has been a cornerstone in my professional journey, enabling me to elevate the standard of care I provide and positively impact the lives of my patients and their families. I am deeply grateful for this opportunity and look forward to continuing to serve my community with the enhanced capabilities this program has afforded me. Thank you.
The Chairman of Merck Foundation, Prof. Dr. Frank Stangenberg, Haverkamp, and Senator, CEO of Merck Foundation, Dr. Rasha Kelej, distinguished guests, fellow Merck alumni, ladies and gentlemen, good morning. My name is Dr. Eugene Berfi Ampofo, a senior resident in cardiology at the Kolebu Teaching Hospital. I applied to study preventative cardiovascular medicine under the PGDIP MSc Preventative Cardiovascular Medicine program at University of South Wales after a colleague of mine introduced me to the Merck Foundation Scholarship. Fortunately, my application was accepted and I completed the program in 2022. The course was an online program, mainly on the learner platform, which was a friendly, interactive program. Most importantly, it was convenient, allowed me to combine work and studies. However, due to increasing demands of my residency training and assuming the role as the chief resident, I deferred the MSc to 2024-2025. However, the course empowered me to appreciate the importance of preventative cardiovascular medicine, especially in the appropriate use of risk stratification and lipid management to minimize cardiovascular disease. I must say that cardiovascular disease is on the rise in the country. However, as a country, we are not there yet with respect to interventional cardiology and the management of the cardiology condition. So the best way as a country is to institute measures to prevent these diseases in the first place so that we can effectively use the resources we have. With the knowledge I acquired, I trained groups of doctors in the appropriate use of statins and lipid-lowering therapy and showed them how to effectively do a cardiovascular risk assessment. I recommend this program to every clinician, and I'm grateful to Merck Foundation for this fantastic opportunity. Medas.
Good afternoon to you all. I want to stand on existing protocols, and on this occasion, I want to say a big thank you to Her Excellencies for the opportunity I had to partake in this postgraduate training. I participated in the postgraduate respiratory diploma course from March 2022 to March 2023. And one of the reasons I sought to do the course is that I believe that expertise has to be brought to the primary care. As we seek to train specialists, we risk having a health system where the experts are accumulated at the top tier of our healthcare delivery in the tertiary facilities, whilst at the ground level, the situation remains as it is, not the best of care. So my passion is to bring expertise to primary care. So let me say that I'm a family physician. I work at Finney Hospital and Fertility Center, which is a private facility. Before then, I was at the Kolebu Teaching Hospital. And one of the main reasons I decided to undertake training in postgraduate respiratory medicine course is that I'm heavily involved in asthma care in the country. I am involved in training healthcare workers in the management of asthma, and also I'm one of the main coordinators of the Ghana Thoracic Society asthma guidelines, which we launched last year, and that couldn't have been possible without the expertise I garnered from the program. I've been involved in setting up asthma clinic. I initiated asthma clinic at Kolebu Polyclinic, and I have started 2 other asthma clinics, one at the Dansoman Polyclinic and also where I work now, Finney Hospital. We are about to start an asthma clinic at Legon Hospital, which I was privileged to be the person who trained the doctors who are going to run it. One of the people I trained has started an asthma clinic at Tamale Teaching Hospital. So the main impact of the training I had is in the space of delivering quality care in asthma management. The experience I had with the training was a bit different from what I was used to. Somewhere along the course, I wondered whether I had made the right choice, because the course was really hectic, so hectic. Initially, I thought the online platform was not going to be it, but it ended up delivering more than I expected. The faculty I had were fantastic, and one very important experience I had was the benefit of having people from all over the world, sharing ideas on the same platform. So I learned a lot from them. I remember there was once I was leading a clinical ward rounds, and we came across a patient who was unconscious. And everybody was wondering what it was. But when I listened to the case, what I learned from the course came up. It was a patient with respiratory failure that everybody thought had a stroke. And there it was, a patient in respiratory failure who had accumulated carbon dioxide in his blood, and because of that had become unconscious. But everybody had missed the diagnosis, and I would have missed it too if it wasn't for the training I had. So the long and short of it was that
Thank you.
right there, I picked up the diagnosis, the patient was saved. And it was a patient who was actually near death. Recently, we had a similar case. I got a patient out of trouble. And when I was interacting with my colleague workers, I asked them, that's what would have happened to this patient if I didn't have this expertise. So I must say that the course has had a transformative effect on my career, and it's my patients who stand to benefit the most, and also colleague health workers that I'm privileged to be involved in their training. So thank you very much for the sponsors.
Thank you very much.
Her Excellency, Mrs. Rebecca AKUFO ADDO, Professor Dr. Frank Stangenberg, and Madam Senator Dr. Rasha Kelej. Dear colleagues, ladies and gentlemen, good afternoon. So I actually have different surname, Anastasia Abu. Maybe that will clear all your questions while I'm standing here. So I've been practicing in Ghana for the past 12 years, and mostly in the northern sector of Ghana, Upper West. And my journey with Merck Foundation and Masters in Endocrinology started in 2020, when I was a medical officer at Upper West Regional Hospital, which is now one municipal hospital. Since the beginning of the region, we've never had an endocrinologist in the region, so I was thinking it is a good idea for us to have one. Currently, I'm a pediatrician, but still have a passion in endocrinology. Generally, our journey with Merck Foundation and then MSc in endocrinology was very smooth. It was an online study, as my colleagues already mentioned. Let me go quickly and talk about impact of this course in lives of people of Upper West. Initially, we had it was not an endocrine clinic, it was a diabetes clinic, which was run by nurses. But when I joined the program and I completed, we actually grew the clinic up to endocrinology clinic, and because of my passion in children, and what we mentioned today is so dear to my heart, empowering a girl child and then bringing education where it was not brought before us. It's what we are advocating for, above from endocrinology. So we are continuing growing our endocrine clinic at one municipal hospital. We are having not only cases in diabetes, but in other conditions of endocrinology, and we're also involving children, so children with different endocrine abnormalities. We are grateful for Merck Foundation for this great opportunity, and we hope to continue our partnership together. Thank you.
Thank you.
Thank you once again, Merck Foundation, senior colleagues and colleagues, ladies and gentlemen, all invited guests here. My name is Commander Finkansa, for the Specialist Family Physician in 37 Military Hospital. I am a proud beneficiary of the Merck Foundation scholarship scheme that is in diabetes management. I gained the opportunity to undertake the postgraduate diploma in an MSc in diabetes management in the University of South Wales. That was in September 2020, and completed in 2021. The course was an online one, and as rightly said, but still we all thought that we were going to have, our way, but it was very tough. It was well structured, organized. It had about 6 modules, which quite flexible that you could combine it with the work, but it wasn't an easy one to talk about. It was comprehensive. We had a wide range of subjects that took us through the diabetes pathophysiology management, the paradigm in terms of diabetes management, as well as advancement in treatment and all the new management strategies. The instructors were very tough, but very concise, precise, and they were certain in terms of their management. And in that course, that was the course that when you are consulting, you hear the notifications just running, back to back, and your heart will just be sinking because you haven't done yours, and if you are not careful, you are going to be way behind because it was a non-stop thing. The instructors were actually very knowledgeable in terms of theory, and they had a lot of practical insight and put in very real-world applications. I have benefited so much from this course because it has helped me to be able to apply myself as well as to help my patients. One of the best things that I think we have done in terms of diabetes care is to set up what we call a dedicated diabetes clinic, and this is something that I learned from the program, and in that we use the diabetes self-management education as one of our tools together with a multidisciplinary team to be able to help our patients in terms of diabetes management. Per this, I use the structure to compare during my fellowship training, to compare with routine diabetes care, and it came out that patients who attended the dedicated diabetes care had very good improvement in outcomes, that is the glycemic control as well as their quality of life, as compared to those who were in routine care. So what it seeks to do is to help patients, empower your patients so that they could take care of their management. So this is something that I think I acquired during my training in the postgraduate diploma. I've also been able to do a lot of training of junior colleagues as well as colleagues and even nurses and pharmacists. I say that it's a multidisciplinary team. We go through a lot of education, a lot of patient educations. We've also been able, during our diabetes week, we haven't gone past it. Every time during our diabetes month, that was last year November, we had a very big, setup throughout the hospital, and they ran the whole week. We did a lot of screening, a lot of educational materials for the patients as well as for us. There's also been some community outreaches that we have achieved so far. So I'll say that this is the best thing that could have happened to me, and I thank Merck Foundation once again, and I'll say that it is a tough journey, but it's a doable one. I think I have been able to do it, so everyone who is on this journey should be able to do it. It has advanced my professional practice very much, helped me in taking care of my patients, and we'll proudly say that our dedicated diabetes clinic in the military hospital, it's been elected as one of the Center of Excellence in Diabetes Management. So that is what we have achieved so far. Thank you so much.
Professor Dr. Frank Stangenberg Haverkamp, Senator Dr. Rasha Kellage, distinguished alumni, colleagues, and honored guests, good afternoon. I guess everybody is wondering about my name. I'm a Malian, married to Ghana, so love brought me to Ghana.
That's right.
Yeah. I'm a principal medical officer and a clinical coordinator of Butano Polyclinic, located in the Gasau district of the Greater Accra region. I consider myself fortunate to have been awarded 2 sponsorships from Merck Foundation. The first one was a postgraduate diploma in diabetes management, and the second one was the master's in diabetes from 2020 to 2022. When I embarked on this academic journey, I was serving in Central Region in a small district hospital, APAM, and as we know, it's a fact that most specialists are always in a tertiary or regional hospital. And we doctors working in underserved hospital, we are always lacking that specialized and expertise that our patients need. So when the opportunity came with these courses, it was really a dream coming true. And then the program was very flexible for me personally because I didn't have to take time off from my work. In district hospital, we are always small doctors, maybe 2 or 3 together. So sometimes when one leaves, it's become so hectic to work. So I could still continue to do my work and then still go for my classes when I have the time. And at the same time, I could also attend to my kids. I really found the program interactive, open-minded. The tutors were respectful. And then, we are plenty on the same platform with different backgrounds from Asia, Africa. So it was like traveling without moving. And I really appreciate that fact. Personally, I didn't have to wait for the program to end before to apply what I learned. So I was working and then applying what I learned every day. And I was at the same time training my colleagues about what was new for me. So at that time, I was also the clinical coordinator. That was my previous facility. And it's always expected for you to bring a certain standard to the hospital. And at least to make all your prescribers should be on point. You want to give the best of experience to your patients. So really when this opportunity came, it allowed me to really strengthen our diabetics and hypertension clinic that were always existing but not really strong. And we have been able since then put in place a screening that everybody that visited our hospital, because we know that data show that 50% of the people with diabetes are still yet to be diagnosed. So it was a strategy for us to screen everybody that was coming to be able to detect them earlier and start the treatment. I was working with a obstetric and gynecologist and a surgeon. And then with them, I've been able to manage some diabetic foot cases because we are not having the expertise. And then he was taking care of the surgical aspect, and I will be taking care of the, to make sure that my patients have their sugar control. So one case that makes me very proud of myself, I work with my obstetricians about a case, a lady in her late 30s, which had a history of multiple miscarriages. And she was known having type 2 diabetes, but the sugar was not controlled. And she had challenges to come for most of the time review and medication because of financial issue. So we took it personally on ourselves to make sure that this woman can have a blood sugar control and make sure that she delivers a first safe baby. And we really succeeded in doing that. And I was so proud because we didn't have to refer this woman to Cape Coast, which is at like 2 hours from where we are, and she was now having the money. So I was really proud of myself. And that was when I was doing the diploma. About the masters, the main aspect that I liked was the research aspect. And when I did my thesis, I dared to do a meta-analysis, which really brought me, earned me a distinction. So as a Francophone with a French background, it was really an achievement for me because Acute Medical and Financial, you have been able to improve your English and then your professional achievements. So my expectation, as I like taking care of patients, supporting them and impacting them, I'm interested in opening a diabetes education and management centers. I'm also interested to do more research on diabetes. Yes, I know I'm dreaming big, but it's good to dream big because everything starts by dreaming. Finally, I would like to really thank Merck Foundation, Senator Dr. Rasha, Dr. Frank, and then the whole team for their dedication and commitment to building capacity in Africa and worldwide. Thank you.
Time is fast spent, so I would like to stand on existing protocol. My name is Elizabeth Banker. I'm a family physician and specializing in adolescent care. I started an adolescent care clinic, actually the first of its kind in Ghana, and taking care especially of adolescents at the Greater Accra Regional Hospital. And I was privileged to be given the opportunity and scholarship by Merck Foundation to do the postgraduate diploma in diabetes, in obesity and weight management. I wanted to take care of diabetic patients, but then I found that if I needed help with diabetes, there were so many diabetologists, but then for obesity, there was no one that I could reach. And I was dealing with adolescents, so I thought maybe this would improve my work. So we know that prevalence of obesity is of public health concern right now. We have about 350 million children and adolescents living with obesity. In Ghana, the prevalence is about 13%. And we know that percentage of children living with obesity increased almost 50% in the last 2 decades. And that 75 to 80% of adolescents who are obese now will have obesity in adulthood. The impacts include cardiovascular disorders, type 2 diabetes, and then PCOS, which can impact their reproductive health, and also orthopedic complications. As far as females are concerned, the girl child, I'm very concerned about that because we know that obesity due to inactivity translates to early osteoporosis and other things. After completing my diploma, I have been equipped to take care of adolescents and young people with obesity. Actually, I was inspired by a 14-year-old who weighed over 160 kilos, and it has been very, very helpful to me. And I've been able to provide evidence-based care. Also, I've been able to help set up a staff fitness program at the Greater Accra Regional Hospital as part of the Lifestyle and Wellness Clinic. And also, it is also added to my repertoire of lectures that I give to residents in family medicine and also at the Ghana College of Nurses and Midwives. So I am very grateful and privileged to have received this opportunity from Merck Foundation, and I'm looking forward to furthering it in my master's program. Thank you very much.
Good afternoon, Prof. Good afternoon, Senator. Good afternoon, fellow Merck Foundation alumni, and good afternoon, ladies and gentlemen. So I'm Dr. Emefa Jojome. I work in the Accra Psychiatric Hospital, and I'm sure you would agree with me that if healthcare is underserved, then psychiatry is the underserved of the underserved. 3 years ago, I started a program with the University of South Wales in clinical psychiatry. The impact of the program for me was not just in the knowledge base, but in the case discussions, the vast experience of people from diverse backgrounds, giving you some idea of the similarities between the cases, the differences, interventions that had been started in other places. For me, the network of practice that I received is inestimable, it's invaluable. So thank you, Merck Foundation. And thank you to the Merck Foundation coordinators who will check on us every few weeks to ask, how's the program going? Do you have any challenges? Can we help? And that was so helpful. In mental health, you find that the empathy of the caregiver is paramount. And immediately I started the diploma, I started to see an improvement in my patient outcomes because I could understand the phenomena that they were experiencing. We had people with lived experiences in my cohort who could say that when I have hallucinations, I think about it this way. And restructuring my cognitive strategy helps me to adhere to my medication, helps me to live with the hallucinations, helps me to live with the delusions. It's always, it gives a physician pride to see their clients doing well and functional. And for me, my greatest success story right now is that of a client I met who was living with bipolar affective disorder. The stigma is overwhelming, but I didn't have anyone I could refer him to for cognitive behavioral therapy in psychosis. But I had done that for my research in the program. And after a few sessions, I realized that adherence was better. And I'm very proud to say that he's completed senior high school. He's in medical school now. So thank you to the Merck Foundation. The effect of what you are doing is not just found in the caregivers, but in actual people. So God bless you for investing in us. We won't make you regret it.
I want to ask you one question. How many psychiatrists was available in Ghana?
Okay, at the last count, we have about between 80 and 90 psychiatrists to the entire population. So that's over 20 million plus.
Yes,
so that's a wide treatment. Exactly.
Yeah.
Exactly. So we're grateful if you could train more people in clinical psychiatry.
Too much gap.
Good afternoon. Permit me to stand on protocol already observed. I'm honored to give an account of my experience to such an august audience. My name is Dr. Florence Akomia. I'm a physician specialist and a cardiology fellow in training at the Kolebu Teaching Hospital, and I'm also affiliated to the National Cardiothoracic Center. I was opportune to have, early in my career, to have won the Merck Foundation Nationwide Diabetes and Hypertension Award, and I pursued an MSc in Preventative Cardiovascular Medicine with the University of South Wales. Living and practicing in a resource-limited country, an opportunity to gain specialized skills aimed at improving clinical care and research is invaluable. The insights and expertise I gained through the course has impacted my clinical practice, public and patient education, and advocacy. I am a member of the Ghanaian Society of Cardiology and actively participate in activities such as scientific meetings, mass education, health screening, and the development of the National Cardiovascular Guidelines, which is currently under review. I recently worked on a project as a coordinator for the National Cardiovascular Emergency Response Network, which was an initiative that provided training and education for thousands of healthcare personnel across the country in cardiovascular emergency care. It has been fulfilling to be able to impact my community in such a positive way. As an alumnus, I have had the opportunity to attend the Merck Foundation Africa Asia Luminary in the past, where I participated in scientific meetings and networked with experts. This piqued my interest in research, and after further training and mentorship, I have been able to contribute 9 published manuscripts to the scientific community, with several others in various stages of development. As an educator, I work with the University of South Wales, tutoring modules in both the preventative cardiovascular medicine, postgraduate diploma, and MSc courses. I also work as a part-time lecturer with the Family Health Medical School here in Ghana. I continue to explore avenues to give back to the society at various levels, and I'm currently working on a project to incorporate health education and promotion through extracurricular activities at the junior and senior high school levels, such as debates and quizzes. I won the Hypertension Award in 2016, and 8 years down the line, I continue to benefit from the experience. By actively participating in alumni activities, I see that the Merck Foundation has not rested on its oars, but has diversified and broadened the scope of aid it provides to improve healthcare in developing countries. So congratulations, Merck Foundation, for building such a timeless legacy. Thank you for all you do.
Thank you.
Thank you very much.
1 minute. I want to ask you something. You said that you are entering the intra-curriculum of the students' school about hypertension and diabetes?
Yes. So I went through quiz and debates to engage the adolescents in junior high school and senior high school.
Very good.
So it's something that is still rudimentary, but it's in the works.
Fantastic. I will share with you, please, my team, remember, share with you the animation films of Jute Sugar Free and Mark's Pressure, because this could be a good tool for the students to learn about this in a very also entertaining way, even the younger students.
Yes, please.
Okay, I will do that. Will you be able to?
Yes.
Add it.
It's a
Great.
good resource that we can use.
Thank you.
Thank you.
Great news.
Bye.
Great.
CEO of Merck Foundation, all protocols observed. I am Frank Osi Brown, a specialist OB-GYN and Merck Foundation alumni. I used to work with Presbyterian Hospital in Afram Plains for almost 15 years. Currently with University of Koforidua Tenka University Clinic as their medical director for medical services. My program was started in March 2022 when Merck Foundation gave me a scholarship to pursue postgraduate diploma, sexual and reproductive medicine, then subsequently MSc in sexual and reproductive medicine after a distinctive work. The program was quite intensive, combining work and following up with the models. What I cherished about the program was the community of learners that I got myself involved with. That brought a lot of expansive overview of the socio-cultural dynamics underpinning fertility management across the learners. And it helped me to appreciate how to ensure comprehensive empathetic care for couples. One of my excited outcomes or achievement was when I managed a couple who have been battling fertility for the past 10 years. Now, this lady took seed and had a miscarriage. And the problem was an underlying uterine fibroid. Being 38 years, I did surgery for her. And down the line, she conceived. I had a cesarean session for her for a baby boy just barely 3 weeks ago. I can see the smile and the excitement in the faces of such couples. Down the line also, I am involved in undertaking health education in sexual and reproductive medicine, vaginal health, and empowerment of young girls to safeguard and protect their fertility and well-being. What I've encountered over the period is where I approach my patient with the dedication and the empowerment that is building community of care along the value chain. Currently, I am in league with Merck Foundation alumni along the fertility value chain, where I'm able to escalate difficult cases for attention. This indeed is helping to improve healthcare service provision, especially at the primary care level,
where there's serious challenges with expertise. And in building capacity is going a long way improving the health of the individuals. I must say that Merck Foundation is really impacting life along the value chain, and that I want to say that we are grateful for all the wonderful things Merck Foundation is doing, especially in the More Than a Mother movement. I'm grateful. Thank you very much.
Thank you very much, Doc.
Good afternoon, colleagues and other practitioners, and Prof. Frank, Dr. Rasha College. Yes, 2017, I think it's almost about seven years since I started the fellowship program with Merck Foundation. We had a 3-month fellowship program in India, and then further pursued the master's program of 2 years, biotechnology, human embryology, and reproduction. When I did this, I decided to study the value chain of the entire scope of treatment, and I realized that there was a gap, especially with the traditional treatment of infertility and the orthodox one. Because I had an opportunity to be in Kumasi to do some work, and over the radio, please, if you are into herbal and stuff, bear with me. But they tend to have almost one medication for everything, infertility. So I did some few work, went around, and I realized that they had the numbers, but the education was not that good, because you cannot easily just do that without assisted reproduction as well. So from there, I had a couple of, I put together a consortium of, should I say, alumni, who were also into, infertility treatment and all that. And we have started doing a lot of work in this area. Now 2 centers already have been set up, from this. One will also be set up this particular year, and one next year. We are not only just focusing in Ghana, but we are also helping those in the sub-region. And hopefully next year, a lot is going to come out from the sub-region as we speak. So thank you very much, Merck Foundation, for this opportunity. Thank you once again.
Hello, good afternoon, Professor Frank, Dr. Rasha, and all fellow alumni. I'm highly honored to be here at this year's Merck Foundation Alumni Summit. My name is Joshua Doboy. I'm an embryologist at Lister Hospital and Fertility Center. As a proud alumni, I had the privilege of completing my MSc degree in biotechnology of human-assisted reproduction and embryology at the University of Valencia, Spain in 2023. Prior to that, 5 years ago, I had completed the 3-month certificate program in Manipur University, India as well, kind courtesy of the Merck Foundation Scholarship Program. The Foundation Scholarship Program was highly incredible. The curriculum were well structured, and the learning environment was super. Since completing the program, I've had a privilege to have a positive impact on my patients and the community as a whole. Particularly, a challenging case that stood out for me involved our team at Lister Hospital successfully performing Ghana's first pre-implantation genetic testing for monogenic diseases. This procedure allowed a couple who were sickle cell positive to have a healthy, unaffected baby. This is a testament to the skill and knowledge I had acquired through the Merck Foundation Scholarship Program. The scholarship program has enabled me to achieve several vital milestones in the field of ART. I have become proficient in complex ART techniques, particularly in biopsy, in embryo biopsy and tubing. This is a complex and a delicate technique, and I'm fortunate to be one of the few Ghanaian embryologists who have died this kind of skill to help couples who are both sickle cell positive to have healthy, unaffected children.
Awesome.
Yeah. Also, I'm engaged actively in fertility awareness program with patients and organized group to promote health education and community awareness whenever the opportunity arises. In conclusion, I would say I'm deeply grateful to Merck Foundation for transforming my career and allowing me to make a meaningful impact on the life of my patients in my community, my country as a whole. Thank you once again for this wonderful opportunity. I wish you all a successful summit.
Thank you very much. CEO of Merck Foundation, Senator Dr. Rasha Khalej, Chair of the Board of Trustees, Prof. Stangenberg, Haverkamp, all protocols duly observed. Good afternoon. I undertook the postgraduate diploma in preventive cardiovascular medicine from the year 2021 to 2022, and it was very eye-opening. There were particular modules that were very influential in my clinical practice. Even though I had been in internal medicine and cardiology, I hadn't paid that much attention to cardiovascular risk assessment, nutrition, and communication in managing cardiovascular disease. And these were very important modules that were covered, as well as the management of cardiovascular disease in special populations, like children, pregnant women, patients with chronic kidney disease, etc. Following this, I continued on with a master's in preventive cardiovascular medicine. And going through the entire program, one thing that really developed was my scientific writing, because all submissions need to be researched and written that way. So as a result of that, I've developed competence in writing and reviewing proposals and research papers. I've actually reviewed a few publications. I've made a few publications as well and have some other proposals being developed. In terms of clinical practice, I'm actively involved in training residents in internal medicine and cardiology. So then I'm able to impart that knowledge to them. Just last week, I had discussions with staff of a bank trying to set up an opportunistic hypertension screening program over there. Because we can't have everyone going to hospital. But if you have something set up like that in a bank where everyone goes, then if you have a setup there where blood pressures can be checked, at least it can be a screening point. And the proposal was sent to them earlier this week. So hopefully it goes through, and then we have something that can start and grow to something bigger. And because of the immense benefits I've got from this program, I've also been recommending it to others who have applied. Some have gotten, some haven't, and will try applying again. But ultimately, I'm very grateful to the Merck Foundation for this opportunity. It's definitely impacted my practice and my research habits positively. So thank you very much, and may God bless us.
That's right.
Thank you.
Just 1 minute. There is Mark's Pressure animation movie, and there is the storybook. If you can grab one from here on the table later. I want to share it with you so you can share it in this program, because it's a very important tool to raise awareness about hypertension. The question is, how much the incidence of hypertension in Ghana?
So the current incidence is at about 35%.
Which is very high, yes?
Yes, and of this number, less than half are aware of their diagnosis, and Less than 20% are controlled.
Okay, so you see, so awareness is very important in that, in addition to, of course, professional doctors and skilled doctors. So please take the animation film seriously, because it's a really good tool for prevention.
Okay.
And the book, storybook, which are the same actually, but one can people read and the other one can listen to and watch, which is good as well.
Sure. Thank you very much.
The CEO and the chairman of the Merck Foundation and all other protocols observed, it is a great honor and privilege to be standing before you here today. My name is Dr. Emily Martha Norte, a physician specialist with the Department of Internal Medicine of the Kolebu Teaching Hospital with special interest in gastroenterology. I'm currently studying the postgraduate diploma in gastroenterology with the University of South Wales as a beneficiary of the Merck Foundation Capacity Advancement Scholarship Program. And I want to believe I'm the first beneficiary of this program. It is my desire, my desire to someday become a renowned consultant gastroenterologist. This program, I must say, has been extremely beneficial and has far surpassed my expectations. It has widened my scope with regards to the diagnosis of conditions of the gastrointestinal system and opened me up to evidence-based management options of various conditions. That has gone a long way to positively impact the lives of many of my patients. Learning is made very easy through the guidance of seasoned professors, as well as contributions from colleagues from all over the world through a user-friendly online platform. I highly recommend this program to all my fellow colleagues who wish to enhance their knowledge in their various specialties. Thank you so much, Merck Foundation. I'm very grateful.
Sorry, thank you.
Good afternoon. All standing protocols observed. Ladies and gentlemen.
Silence, please, just to listen to our colleague.
Ladies and gentlemen, my name is Frank Mausia Tutonu. I'm a doctor with the 37 Military Hospital, currently working at the Polyclinic in Accra. I am a current beneficiary of the Merck Foundation Scholarship for postgraduate diploma in family medicine. The foundation scholarship was highly recommended to me by a colleague doctor, which he also benefited from. Initially, I was very apprehensive of the course content and the online method of delivery, but I soon realized that this wasn't a walk in the park. I had to sit up long nights and days to keep up with the rigors of the course. The tutors were relentless with reminders, and which keeps me on my toes. The course content is appropriate and current, and the teaching materials are now my reference materials for me and my colleagues. My practice has improved greatly based on knowledge gain. I'm better able to screen patients at the polyclinic and only refer necessary ones to the specialist. My diagnosis and treatment of patients has improved, and sometimes knowledge gained I also discuss with specialists and my colleagues. So the purpose of Merck Foundation is clearly served. I transfer knowledge gained in consultations, whereby we hold 2 weekly presentations in our departments, which I share with most of them. By this, more doctors are being current in the latest material which I have learned. So I humbly want to request the Merck Foundation to increase the scholarship for more doctors. And thank you very much.
Good afternoon. Standing on all existing protocol, my name is Dr. Wilhelmina Inen, currently offering a diploma in preventative cardiology. I'm also a cardio fellow in training. Back in the second half of 2023, I was selected by the Merck Foundation to undertake a diploma course in preventative cardiovascular medicine, and I'd like to share some of the amazing benefits. I'm from a low middle income country, which I'm sure you already know, where most times patient care focuses on treatment rather than prevention because of poor health-seeking habits of the people we usually meet. People end up coming with cardiovascular complications instead of the signs and symptoms of early stage of the diseases. Through this course, I have learned very effective ways of communicating with my patients and helping them understand the benefits of early detection and treatment of some of the diseases, especially the cardiovascular ones, and also ways to involve them in management. Through discussions on the academic forum, I've also learned and adopted some approaches and guidelines used by other medical professionals in other parts of the world for effective disease management. And this has been very beneficial to people that I see in the clinics. With time, I have started experiencing or seeing some of the benefits. People come to the clinic with better understanding of the diseases they have, how to manage them, and how to even involve other members of their community, and how to advise others about their diseases and then their diagnosis. It's been a very insightful one for me. And also as a cardiology fellow in training, the course offers me the opportunity to delve into other topics of great importance, to see what is happening in other parts of the world. And I am very grateful for this opportunity. Thank you very much.
Good afternoon, the Chairman, Merck Foundation. Good afternoon, CEO. And good afternoon, ladies and gentlemen. My name is Gloriania Samoa. I'm a family physician and I work at Kolebu Polyclinic. I have had a long-standing relationship with Merck for about 8 years now. I completed my diploma in 2017 and my master's in 2021, and it has really been an interesting relationship. And so I think after my diploma, I realized that there was so much information I had about diabetes, and so it was a great opportunity to go ahead and do the master's as well. And this has really increased my knowledge in diabetes. It gave me a better understanding of diabetes and has helped me to provide holistic care for my patients. Currently, with the help of other diabetologists at the polyclinic, we run a chronic care clinic for our patients with cardiometabolic diseases. We look at diabetes, hypertension, obesity, and this clinic has really been of great benefit to our clients. It is an appointment clinic, so they come in at their own time, and we're able to have enough time to sort of take care of them. I have also been engaged in a research that's looking at structured education in the management of patients with cardiometabolic disorders, and we have currently completed a feasibility study, and the outcomes have been really great. So I'm looking forward to doing more research in the care of patients with diabetes so that we can help improve the care that we give our patients. Thank you very much.
You are one of the fewest rheumatologists in Ghana. How many are there?
2 adult rheumatologists.
Only
and
2?
One pediatric.
And 1 pediatric, and what, you are the third?
Hopefully, yes.
Yes.
Hello, everyone. I'm sorry this is coming in a little late, but please indulge me. My name is Amajedo Abuedu. I am staff of Cape Coast Teaching Hospital, but currently in Kolebu Teaching Hospital. I was fortunate to have received a scholarship to pursue a postgraduate diploma in rheumatology, afterwards an MSc as well. But why rheumatology? I get this question a lot. My colleagues ask me this question a lot. Why rheumatology? And it's like, it's a surprise. Why? And well, you'll know soon. I didn't start out wanting to be a rheumatologist. It was not even on my mind. When I was in final year, my classmate is Eugene there. One of my consultants called me a budding cardiologist. So that tells you where my heart was. But in my internal medicine residency, when I started rheumatology rotation, that was what changed my life and my mind. So I saw young women, and they are the largest population of rheumatology patients worldwide. women mostly in their reproductive ages. And I saw these young women who were afflicted with very severe manifestations of things like SLE, systemic sclerosis, rheumatoid arthritis, the deformities that they had, and how much it impacted their lives. And truly, most Ghanaians do not even know what rheumatology is. And so I felt that if I wanted to make an impact as a doctor, then in Ghana, and the cardiologists are here, there are more than 20 of them. There are more than 10 cardiologists in training right now. Guess what? There are only 2 rheumatologists serving the whole of Ghana. And 2 adult rheumatologists, 1 pediatric rheumatologist. The adult rheumatologists are in Accra. The 1 pediatric rheumatologist is in Tamale. And so I really felt that, yeah, if you want to make an impact, then join the rheumatologists. It's a difficult place. Patients are unable to afford care. Our investigations are expensive. And, well, in Cape Coast, where I actually practice, there's no one. So once I began my postgraduate diploma, I got the confidence to start treating patients. And it was such a joy to see young women who would have otherwise passed on go back to school. There was one with SLE who had peritonitis. There was a nursing student. There was one female who was a student at the University of Cape Coast. And after months of battling in hospital, they went back to school. And I saw them come back for review, and it was such a joy for me. Before I left Cape Coast, anybody who had a patient who they thought was would be a rheumatology case, they would say, call Amma. And it was really fulfilling for me. Now I'm in Accra pursuing my fellowship in rheumatology, but I'm looking forward to going back to Cape Coast. And I know that very few people in Ghana will say, I want to leave Accra and go to Cape Coast. But that is my dream. And I want to make rheumatology accessible and somehow financially accessible for my patients, and see that difference that it can make. I don't know how I'm going to do it, but I know that I'm going to do it. And also I get to teach students, and with that, I've become an ambassador for rheumatology. Anyone who will listen, do rheumatology, become a rheumatologist. So I am here very grateful for the opportunity you have given me. But like Oliver Twist, I cannot sit down without asking that if you will help this burdened rheumatologist with an on-site program so that she can be the very best that she can. And then I hope that you'll be part of this brilliant journey that you have already set me on, and then we will see bigger things happen. Thank you so much for the opportunity.
Thank you very much.